Minnesota has a Human Rights Act that prohibits discrimination in the areas of business, credit, education, employment, housing, public accommodation, and public services. Despite that law, Minnesota has some of the largest disparities in the country in some of those areas. That's why the Minnesota Department of Human Rights was created. It is a state agency that investigates charges of illegal discrimination and strives to eliminate discrimination by educating Minnesotans about their rights and responsibilities under the Human Rights Act. On today's episode of A Public Health Journal, we'll be examining the role and activities of the Minnesota Department of Human Rights and find out what's being done to improve the quality and equality of our life in our state. Please stay tuned.
Welcome to A Public Health Journal, a program that explores public health issues facing our society today and tomorrow. The host of the show is Dr. Ed Ellinger, Commissioner of Health for the state of Minnesota. A Public Health Journal is sponsored by the Minnesota Department of Health and the Hennepin County Human Services and Public Health Department, all working together towards the goal of healthy people living in healthy communities.
Welcome to A Public Health Journal. Today we're going to look at what's being done in Minnesota to assure that everyone has equal opportunity for employment, education, housing, credit, and a variety of public services. In particular, we'll be looking at the services of the Minnesota Department of Human Rights and its role in helping protect the human rights of every Minnesotan. Joining me in this conversation is Kevin Lindsey, Commissioner of the Minnesota Department of Human Rights. Prior to his appointment as Commissioner in 2011, he served as a civil litigation attorney in the Office of the Ramsey County Attorney. Commissioner Lindsey has more than 20 years of experience in resolving complex legal and public policy questions. Kevin, thank you for being on the program and welcome.
Thank you very much for this opportunity. I really appreciate it.
Well, let's start out, with basically the name of your department, the Department of Human Rights. What do you mean by human rights?
Sure. Human rights really talks about civil rights in the context for the state of Minnesota, and that means that having an opportunity to be gainfully employed on the job, being able to enjoy the benefits of government services, to be educated, to have proper health care, and for housing. So we seek to ensure that all Minnesotans have those civil rights afforded to them, and we try to make sure that there's no discrimination occurring in sort of their application or request for those types of civil rights. And we also try to educate the public at large as it relates to various challenges people might have in gaining those rights.
Mm-hmm. Now, I know the World Health Organization has certain rights of humans, or human rights, and then we have civil rights at the federal level. Are they all in parallel? Do they really support each other, or are there differences in the approach taken at kind of the world level, the national level, and the state level?
No, I appreciate the question. It makes me think of the event that I was at the University of Minnesota last December, in which we had various world leaders talking about international rights and coordinating those interpretations and applications of international human rights across the globe. So it is slightly different, but I do think that there are some common threads, and that is sort of the respect for the individual and the dignity within their sovereign. So as I interpret it here within the state of Minnesota, that every Minnesotan can live to the fullest to the extent that they wish to within our society, and how do we encourage and support them in doing that.
So if somebody in Minnesota has some concern about discrimination for a whole variety of things, how do they know if they should go to the federal or to the state? And I know some local jurisdictions also have some human rights departments. How do people know where to go and what to do?
Sure, and there is no wrong answer to it. What they're really trying to do is seek assistance. So for the Department of Human Rights, you can call our office or contact us. The phone number is 651-539-1121, or you can send us an email at www.mdhr.gov. And if you feel that you have been discriminated, if you feel that you have been inappropriately treated in any area under the law, then you can have your complaint heard by us, and then we can then process that complaint and then determine for you whether we think that there's a basis to believe that you've been discriminated against. And that's a free service. Now, obviously, individuals do not have to utilize our department. They can go into state court or they can go into federal court and utilize the assistance of an attorney. But the Department of Human Rights was really created for those individuals who might be challenged to be able to find a private attorney in the marketplace, but feel that they have been discriminated against, and they want to have an answer as it relates to that point.
So when was the department created?
The department was created back in 1967, and I think it's important in the context of sort of the primary duties for the department. We've talked about sort of investigating complaints of discrimination, but the department also looks at and makes sure that people are afforded equal opportunity to work on state contracts. So we also take a look at state contracts over 100,000, and we make sure opportunities are afforded to individuals of color, women, and people with disabilities. And we really strive to seek and provide opportunities for people to work on state contracts.
Now, the issues that you deal with, are the issues that are brought to you, or do you proactively go out and identify where problems are occurring? Where people, you know, I mean, partly contracting, you know, do you have the right kind of contracts? You know, how much is reactive, how much is proactive in what you do?
That's a good question. It's a little bit of both, actually. So anyone can come to the department and file a charge of discrimination. We're obligated to investigate those charges of discrimination. We have about 900 of those. But we're also engaged in conversation within the community, engaged in conversation with governmental units, and sometimes we'll be proactively involved trying to find a solution to a problem which exists in society. So this past legislative session, when the governor went to North Minneapolis back in 2011, one of the things that he heard is that individuals who had been convicted of crimes were having a difficult time finding employment. So we met with business leaders from the Chamber of Commerce, we met with individuals who had been previously convicted, and we tried to craft an opportunity for them to get in front of employers to at least present themselves to get employed. And that, in common parlance, is sort of what people sometimes refer to as ban the box in the private setting. So beginning January 1 of 2014, private employers will be prohibited on the initial application for asking if someone has been convicted of a crime. And just so that we're clear, that doesn't mean at some later point in time the employer can decide not to hire the individual because they've been convicted of a crime if they really feel that it's warranted. But at least at the initial onset of the relationship or the application, they're prohibited from asking. And people within the advocacy community really believe, and I think rightly so, in that Minnesota in certain instances will give someone a second chance. If they can just get that opportunity to get their foot in the door, that good benefits will happen from that. So that's one which we really worked very hard on in getting passed.
Yeah, well, and you used the word opportunity, and I know we in the health field are working on health disparities and health equity, and it doesn't mean that everybody's going to be exactly the same. There will be disparities just because, for a whole variety of reasons, but we want everybody to have an equal opportunity to be as healthy as possible. It sounds like you really focus on a lot on the opportunity. So ban the box kind of thing is giving everybody an opportunity at least to get their foot in the door to have a hearing for their application.
No, that's a wonderful point. That's really what we really strive to do, is sort of understanding that there's always competing interests on various points, but we at least try to get everyone at least to the line so that they're provided with that opportunity. And as you said, there could be a variety of reasons why something might happen, but everyone should at least be given that opportunity to succeed.
And I want to go into a little bit more about the Minnesota Human Rights Act and what that says, and because I suspect that dictates a lot of what you do. But first we need to take a little break. So we'll be back right after this message.
Or in any other way, unless it harms or offends other people.
Welcome back. We're talking with Commissioner Kevin Lindsey from the Minnesota Department of Human Rights about human rights conditions in Minnesota. Kevin, I know part of your office really works on the Minnesota Human Rights Act. Tell us a little bit about that, when it came about, what it entails, what kind of power that it has in our society.
Sure, I appreciate the question. The act came about in the 60s. There are 3 primary duties. There are 19 duties for the commissioner, but there are 3 primary duties. The first one we've talked a little bit about, and that's investigating complaints of discrimination. The second, which we briefly touched upon, is sort of ensuring that people have opportunities to work on state contracts. And the third one is sort of the largest one, and this is the one in which always is a difficult one for us to balance and prioritize, and that is to eradicate discrimination in Minnesota and reduce disparate outcomes. And because of the breadth of the jurisdiction of the department, that can take us into a wide variety of areas. And we really view ourselves as sort of a conduit, as a facilitator of conversations to reduce disparities. Well, let me come to the second one, since we haven't spent much time on, that's the state contracts. Mm-hmm. So there, what we're really trying to do is be a catalyst in this conversation as it relates to ensuring that we have the right pipeline of candidates for various positions within our society. Most people know the department, if they are aware of it, is it relates to construction contracts. So we do look and examine to see what should be an aspirational goal in the area of construction. So before Governor Dayton took office, the goal in Hennepin and Ramsey County was 11% of the workforce hours for large construction projects. And looking at the population within Hennepin and Ramsey County and the number of individuals in Hennepin and Ramsey County who were ethnic minorities, we felt that it was appropriate to adjust the number to 32%. So we have been working with contractors, unions, education to sort of align that pipeline of candidates, because as you and I both know, the Twin Cities area and the state of Minnesota is becoming more ethnically diverse. And if we don't have a proper pipeline of candidates to work on construction projects or in the healthcare field or in a wide variety of fields, then our region will not be able to sustain itself economically. So we set those goals within contracts, and then we work toward creating an environment in which the participation numbers can be met.
So how do you go about doing that? Because obviously this would require a lot of agencies, a lot of systems to, K-12 education, post-secondary education, private sector. What leverage do you have in changing that pipeline? Because that's a huge challenge.
No, I appreciate the question. So last week we were at high schools in the city of St. Paul with various unions in a project called Construct for Tomorrow. And at those high schools, we brought in individuals from the iron workers, from pipe fitters, from the various trades within the construction industry. And they were demonstrating to the children there as it relates to what potential careers. And as you know, if you can put that idea into a young person's head as it relates to what potential careers that they might have, they now have something to aspire to. That didn't just come about just because of the conversation I just simply had with the unions. That came about because of a broader conversation of trying to get the Department of Education and MnSCU institutions more broadly involved. So about 2 months ago, we had sat down at the table. Commissioner Casilius at the Department of Education was gracious enough to host us, and then I invited some of my friends from MnSCU and from the various unions, and we started to strategically think about how can we get in junior highs, high schools, in front of kids to create that pipeline of potential candidates for various construction industries. Then I also have some conversations with various construction companies, remind them of sort of their obligation to reach out to schools, to reach out to youth internship programs, and also to advertise in ethnic communities about potential job opportunities. Then lastly, we facilitate conversation with community groups that might be working with individuals who are having a tough time getting employed, and to make sure that they're aware of programs in MnSCU institutions and then aware of programs within the construction industry. So working from a couple of different angles, we really seek to reduce disparities.
Now, when you have these aspirational goals, are they goals or are they quotas, or how do you use those and how do you leverage that? I can have a goal, but how do you hold people to say, we're going to keep you accountable for achieving these standards?
No, that is a great question. because sometimes when people hear me talk about this goal of 32%, they only hear as it relates to the word quota, and that if they don't achieve the 32%, that they'll somehow be punished for that. Now, it is true that I do look to see what efforts that they have used, and I do look at that as it relates to the percentage of workforce that they were able to achieve, but it is a more holistic view. It is not one just simply looking at the numbers which were achieved on a project. And I would say this, when we announced the goal back in 2011, we have seen tremendous efforts by individuals in the construction field to work more closely with schools and work more closely with community groups. And if you took a look at all the construction projects going on in the 7-county metro, you would almost have seen a doubling of the number of people of color working on various construction projects. So not every project is at 32%, but where projects were at 11% 2 years ago, we're now seeing them at 19 to 25%.
Are there some carrots that encourage people to do this?
Well, there are carrots that we do use to encourage people to do it, but I want to be very clear. I think folks within construction wanted to do it, and I think that they were really looking for that type of partnership. And I really appreciate sort of the efforts of MnSCU and the Department of Education, indeed, to really try and work with business leaders in a wide variety of areas, not just construction, to really say, how can we wire this in a way such that we create pipelines of opportunities for people?
All right. Well, I want to talk about that third area. You know, you talked about two of the three areas in the last segment. I want to talk really about, all right, what are you doing to really prevent and reduce discrimination in our state, which is an important issue for all of us. But first, we need to take another little break. Okay. We'll be back right after this message.
Underneath everything we are, underneath everything we do, we are all people, connected, interdependent, united. And when we reach out a hand to one, we can influence the condition of all. That's what it means to live united.
Welcome back. We're talking about human rights in Minnesota with Kevin Lindsey, the Commissioner of the Department of Human Rights at the state of Minnesota. Kevin, you talked about the three areas for the Minnesota Human Rights Act, you know, responding to complaints and looking at some of the contracts. But the third one was that huge area of, you know, addressing discrimination. And as we become an increasingly diverse state, like you had mentioned, I'm sure there are more and more issues coming up. So tell us a little bit about how you're addressing that problem of discrimination in our state.
Sure. The very first thing that we're doing in that area is we're really examining it from a different paradigm lens. The first area, complaints of discrimination, people look at that as sort of an adversarial process. And generally they think of it as overt discrimination, not what I would consider what we are finding more common, and that is discrimination which may not be overt, it may be more systemic, and it may be one in which people aren't very conscious of sort of the disparate outcomes which they are creating by their systems. That's a whole different approach.
Sort of the structural discrimination that's there, that's built into our system.
Right. So for the department, in looking at the Human Rights Act, it says that the Commissioner of Human Rights can call on the assistance of all the commissioners in the governor's cabinet. And then to deal with systemic discrimination, that really is a need to educate, conference, conciliation, have dialogue and discussion between various groups as to how they're impacted by various policies, and then to strategically think about, are these policies really serving where we want to go? And maybe they should be modified, amended, or changed in some way to really give us more equitable outcomes and results. So I really appreciate sort of the work of sort of the Olmstead Commission, the Lieutenant Governor's effort reaching across the various administrative agencies talking about how to more successfully integrate people with disabilities. There are a lot of laws on the books trying to assist and help individuals with disabilities, but sometimes those outcomes may not really drive the way in which we want. They may fall short of sort of what we all feel would be the goals that we want to achieve. That doesn't necessarily mean that it's overt discrimination and there's animus in people's hearts, but it could lead to disparate outcomes in which people fall behind. So the opportunity to have regular dialogue, conversation around those, they may provide opportunities to reduce discrimination, reduce disparate outcomes. So we're very much a part of analyzing and looking at systems in that way. And in some ways, it's almost a little bit of a nod even to some of the work which we're doing in the area of business development and job development. It's not necessarily sort of pointing a finger and saying that this person is wrong or this entity is wrong, but how can the system be restructured in a way? How can we be at tables together to bring about more equitable results? So I appreciate your efforts of being at the Humanities Center a couple of years ago and talking with the various state ethnic councils. I've appreciated the opportunity for DEED and education to be at tables with various communities that have felt that they have had disparate outcomes, and we're working on strategically coming up with solutions to problems.
My understanding that Minnesota, particularly in its larger cities, are compared to other places in the country, are fairly segregated by race. Some of the highest segregation rates in Minnesota, Minneapolis, St. Paul. Is race a big issue as we become increasingly diverse? And how are you addressing the underlying racism that really is engaged in a lot of the policies that have been put together in our country over many, many years?
No, that's a fantastic question. So when Dr. Algernon Austin came into town about 2 years ago, he had, at that point in time, the largest disparity between whites and African Americans as it relates to unemployment rates. If you looked at major metropolitan areas, Minneapolis, the Twin Cities area, was #1. And I think that that really was shocking to people given the number of Fortune 500 companies and the amount of economic wealth in this respective area. Now the good news is, in the last 2.5, 3 years, we've made progress and we have moved down that list. The bad news is we're still on that list of the top 25. Some of the things which we have been talking about and working on, the increasing of workforce participation impacted that. The use of extending private ban the box and even elevating that conversation, I think also has assisted and helped out in that. We're starting to see increased graduation rates in high schools. We're not quite where we still need to be, but those will have a more positive impact. So those types of disparities, we're cognizant of them, we're working on them, and we're trying to strive toward it. There's a project which I haven't mentioned, and that is sort of trying to certify businesses being able to do work with government. That's different than the workforce. And we're also reaching out to the various cities, public housing authorities, because if people have an opportunity to become entrepreneurs, business owners, that also has a positive impact. There's a quote from Dr. King that we use from time to time. He says, what good does it does a man to have, and I would have said he would say for anyone, to have human rights if they don't have enough money to be able to buy a coffee and a hamburger. And really, that is, to me, part of this. When we talk about statutes on the books, that's great, but if you don't have the opportunity to be gainfully employed, to be able to put money on, in the bank account, put food on your table and a roof over your house, and over your head, you really are going to fall short.
Yeah. How did you get into this field? You know, as an attorney, with lots of opportunities in the whole area of human rights. How did your path take you to this position?
Well, I think, quite frankly, what took me to this particular position is that there were some individuals on the cabinet that I had worked with in the past, and there were some of my friends from the various activities that I had been involved in. And they said, you know, I think the governor is putting out a call for commissioners, and we think that you should apply, and we're going to encourage you by telling the selection committee that we forwarded your name, so they're expecting your resume. Yeah,
but I'm like the values and the principles and philosophy that you bring forward in your career, which is taking you into this really public approach of dealing with discrimination and human rights.
I think that there are many things. The one that probably drives it the most is probably the example of my mother and father. So they both retired early, and then they decided to retire to my mom's hometown, and then they decided to go put themselves back to work. So my mom started volunteering and being involved in a variety of different things. Unfortunately, she's no longer with us, but right before her passing, she was awarded Businesswoman of the Year for a county in southeast Arkansas. And she wasn't working for a company, but she was so involved in trying to provide opportunities, giving back to the community.
So that family history of giving to the community.
Without a doubt. And it goes beyond just simply my mother and father, on both extended sides of the family. Been very involved.
Good. Well, thank you for your work, and thank you for your partnership on some huge public health issues that we have in our state. Thanks for being with us.
Thank you very much. I appreciate it.
And I'll be back with a closing comment right after this message.
Don't look at me. Your hair's a bit frizzy today. Oh, you should pick that up. Oh, you're such a dork. Loser. Here, let me help you with that. Oops.
Every day, kids witness bullying.
Oh, look. Your crush is looking at you. Or you.
They want to help, but don't know how.
See, no one here's gonna help you, because no one
Teach your
likes you.
kids how to be more than a bystander. Visit stopbullying.gov.
Dr. William Faggy, former director of the Centers for Disease Control, said, "The philosophy of public health is social justice." And Dr. Martin Luther King Jr. stated that of all forms of inequality, injustice in health is the most shocking and the most inhumane. So when you pair these two statements, it is obvious that eliminating health disparities is an issue of social justice, and it should be the primary objective of our public health system. For reasons largely outside of their control, too many people are needlessly dying young and living with unnecessary infirmities. A disproportionate number of these individuals are people of color and American Indians. This highlights the fact that there still exists in our society policies, systems, programs, and institutions that discriminate based on race. In a democratic community that is founded on the belief that all people are created equal with equal rights, these health disparities and the discrimination underlying them should be unacceptable. These disparities are a reflection that we, as a society, believe more in market justice than in social justice. We can do better than that. We must do better than that if we are to prosper and advance as a society. Our challenge is to find ways to create a more socially just society, one that won't tolerate these kinds of health inequities. The first step is to acknowledge that these disparities exist, acknowledge that many are race-based, and acknowledge that they are unacceptable. That is the same challenge that Dr. King gave us half a century ago. It is a challenge that we have failed to meet. At a time when our state is becoming increasingly diverse, it is more important than ever to personally accept that challenge and then respectfully challenge each other to begin a conversation about how to make changes in our social and economic systems that will eliminate those inhumane injustices. That's all for today. Thanks for watching. I hope you can join us again next time on A Public Health Journal.